Welcome to Medicobus and welcome to section 3 of our bacteria. In this section 3, today we will discuss Chlamydia trachomatis, Chlamydophila pneumoniae, Chlamydophila psittaci. Chlamydia trachomatis is obligate intracellular organism. Obligate intracellular organisms are those bacteria or organisms which need ATP for their survival. That's why Chlamydia trachomatis requires host for its survival. The cell wall of Chlamydia trachomatis resembles like a gram-negative cell wall, but it lacks the muramic acid. The cell wall of Chlamydia trachomatis lacks muramic acid. That is the reason it does not stain well on gram staining. There is the most important clinical reason we have to understand here is that it is resistant to the beta-lactam antibiotics. It means that beta-lactam antibiotics cannot work on the Chlamydia trachomatis because it lacks the muramic acid. So those drugs which fall in the category of beta-lactam antibiotics such as amoxicillin, penicillins, other cephalosporins such as ceftriaxone and cefotaxime, cefepime, all of the other cannot be effective to treat the Chlamydia trachomatis. The transmission can occur through sexually. It is a sexually transmitted organism and it only affects the humans. It can also cross the birth canal. Now we will discuss shortly the life cycle of this organism in the host cell. It is different from other bacteria. That's why we are discussing in this video, especially for Chlamydia trachomatis. The life cycle is replicative life cycle, such as elementary body enters the host cell through endocytosis and further divides through binary fission and continues its life cycle. And Chlamydia trachomatis can be stained on the Giemsa stain. Now we will discuss the serotypes of the Chlamydia trachomatis. There are more than 15 serotypes of Chlamydia trachomatis, but we will discuss some of these specific serotypes. So serotype A, B and C can cause trachoma, which deals with the chronic conjunctivitis. It is the inflammation of conjunctiva. The reoccurrence of trachoma can lead towards the blindness as well. Serotype D and K. Serotype D and K can cause urinary tract infections in men and women. We will discuss it separately. So in men, it can cause non-gonococal urethritis, which is characterized by dysuria and non-purulent urethral discharge. As in neisseria gonorrhea, we see thick mucus discharge, and in Chlamydia trachomatis, we see thin mucus discharge from urethra. This is the main difference between these both urethral discharge. The urethritis infection can progress to the epididmyitis and prostatitis as well in men. And now we will discuss serotype D and K in women. In women, serotype D and K can cause cervicitis, which is also often characterized by the vaginal discharge. And cervicitis can lead towards the pelvic inflammatory disease and salpingitis. Salpingitis is inflammation of fallopian tubes. The reoccurrence of salpingitis and pelvic inflammatory disease increases the risk of ectopic pregnancy and infertility in women. Now we will discuss serotype L1, L2 and L3. These serotype can cause Lymphogranuloma venereum, which is also characterized by two classical symptoms such as the painless ulcerations of genitalia and inguinal lymphadenopathy. Chlamydia trachomatis can also give birth to the Reiter's syndrome, the autoimmune condition where we can see the classical triad of conjunctivitis, urethritis, and reactive arthritis. As we discussed in our video earlier that Chlamydia trachomatis can also cross the birth canal. So if a mother which is infected by Chlamydia trachomatis can also infect the fetus. So in fetus, it can cause neonatal conjunctivitis and neonatal pneumonia. These both infections occurs after 2 to 4 weeks of childbirth. Now we will discuss Chlamydophila pneumoniae. Chlamydophila pneumoniae can cause upper and lower respiratory tract infections. The transmission of Chlamydophila pneumoniae can occur through the aerosolized droplets. It can cause bronchitis and pneumonia. Here I have mentioned that it can cause atypical like pneumonia. Atypical pneumonia was caused by Mycoplasma pneumoniae, which is also known as walking pneumonia, which is the least severe. This is the last one of this video, Chlamydophila psittaci. The transmission of Chlamydophila psittaci can also occur through aerosolized droplets. Birds are the reservoir for this species. The primary organ affected are lungs and it can cause pneumonia in lungs. And if it disseminates, the severe form of Chlamydophila psittaci can cause The hepatomegaly and jaundice in heart it can cause pericarditis and myocarditis. In CNS it can cause encephalitis and meningitis as well. So now we will sum up our video with discussing diagnosis and treatment for the chlamydia trachomatis and other species. The diagnosis is done by the nucleic acid amplification test, and in treatment, macrolides and doxycyclines are effective for these species, but especially the drug of choices are in chlamydia trachomatis use it also involve gonorrhea infection, so azithromycin is drug of choice here. And in neonatal pneumonia and conjunctivitis, the drug of choice is oral erythromycin, which is a macrolide. Here CP represents chlamydophila psittaci and chlamydophila pneumonia. In these infections and lymphogranuloma venereum, the drug of choice would be doxycycline.